a lot of discussion around health equities, a lot of discussion around, especially with the vaccine, getting the vaccine to the homeless, getting the vaccine to those who are disenfranchised or even in rural areas. And you have some rural areas around Austin as well. Talk first about the homeless initiative, and then I'd like to sort of delve into technology's role in this health equities and serving that population.
Great question. So number one, we have a phenomenal population health department. One of our lead clinicians, Dr. Tim Mercer, has been leading a number of initiatives with the city of Austin, the Red Cross, homeless shelters. And I'll tell you, my first foray with that when it came to COVID-19 was actually last year when we were using analytics and contact tracing to spot hotspots of where were the outbreaks occurring across the city, and then proactively dispatching teams to those places, whether it's the Red Cross, Salvation Army, the homeless shelter here in Austin. And Dr. Mercer was leading a lot of that work together with my analytics team to figure out where can we go best to make sure that folks have masks, they're isolated. This is before vaccines. Now, the same types of tooling that we developed over the past, call it 8 months, 9 months, are being used for vaccination. Where are the hotspots? Where are people not getting vaccinated? What zip codes are we missing? What county level are we missing? What portions of the city are we missing? And so we try to geomap and look at where are the parts of the city that we're just not getting enough reach to, and then send folks there. And so part of this endowment and others is to take those lessons and codify them into practice so that across all clinical care delivery modalities, whether you're talking about your digital properties like your websites, whether it's analytics like I was speaking about, reporting, or just partnering with the city to say, hey, how do we get Meals on Wheels better effectively deployed? Or how do we do colorectal screening in a better part of the city to make sure we get a better catchment rate and help make people have preventative care and wellness care versus reactionary and emergency care if they don't take care of it. What we have found is the community that's sort of disenfranchised like that, whether they're disconnected or whatever else, they just want to be heard. They want to be engaged. And a lot of times it's fear, a lot of times it's unknown, and a lot of times it's a mismatch of communication mediums. So what UT Austin has done in general has always been to say, how can we level the playing field and open access to all? And a lot of that comes into data. And so now diving into COVID-19, as I even look at who's signing up for the vaccines, I can break it into demographics, ages, races, specifics, and make sure that our leaders, our clinical leaders, are being informed so that if we're leaving out inadvertently any segment of the population, we can react. And so we're constantly evolving and learning from the data and helping people to better understand the importance of a lot of this preventative wellness and care.